Have you ever been bothered by that extra skin that gathers above your knees and on your elbows as you age? Well, did you know there's a fix for that? I've done it and we'll tell you all about it. And later, we're talking about body dysmorphia. This is a good one, my friends, so stay tuned. Party's over. Externally, I wanted to look a certain way, but internally, I wasn't happy. I've had so many procedures, so many treatments, more than I can count. I started to really focus on doing things for my body that made me feel good. I decided to write my book to share this knowledge, and people have really resonated with it. And that night at 5 in the morning, there's a girl at the front door. I was able to figure out what a narcissist was because I was married to a narcissist.
There's some stuff in there I'm very surprised that you're talking about.
I can spot the red flags now from a mile away. I want the viewers of my show to walk away feeling great about themselves and feeling empowered. I'm going to incorporate my story as well in the show, but I also am very interested in learning about other people's stories.
I love your honesty and your genuineness. That's what makes you so authentic and real and why people want to talk to you.
Watch Party's Over. It's going to be fun, informative. We're going to have a great time. Party's over. First up, we're talking about knees and elbows and that extra skin that starts to appear as we age. We're going to talk with an expert who knows all about how to fix that. Dr. Michelle Loeffler is a plastic surgeon, and she's joining us now. Hi, Dr. Loeffler. Thank you so much for joining us today. The viewers have a lot of questions, and hopefully you can answer all of them about cutting the knees and the elbows, which we did the elbow surgery together. And I'm still wanting to do the knees, but I want to tell our audience all about it.
Okay. Let me just start that neither of these procedures are very commonly performed, but a lot of my patients have had plastic surgery in various parts of their body, and all of a sudden their face looks good, their body looks good, but they notice some extra skin creping around their elbows. And I've been doing arm lifts for over 20 years, and the elbow lift is just an extension of the arm lift. We're removing extra wrinkles or skin above the elbow crease. And with gravity and time, everything sags down and there's wrinkles and skin.
Well, that's why I thought it was so great when I found you originally, because I had Googled and researched for a few years, because all of the surgeons that I found did the arm lift, but I only needed the elbow because the loose skin was really bad, but the rest of my arm looked great. So I was so happy when I found you, and that you were able to do the procedure in your office with a local anesthetic instead of going through, general anesthesia or even twilight.
Right. That is the advantage. And when I do it, it's just numbed and you're removing the extra skin, usually a couple of centimeters. And the goal is to have a scar that's in one of the natural wrinkles. You don't want the scar to be too long, but you want to get enough skin that the elbow is tight, that you could still move the arm normally, and that the scar takes time to fade, 6 months to a year.
Yes.
And that's what I started with. An arm lift, then I started with an elbow lift. And then patients have come to me for years for thigh lifts. In the groin incision and along the inner thigh. So we took an extension there as well.
Yes. So now, when I went to do the elbow lift with Dr. Loeffler, I had been complaining about my knees, and she wanted to see how well I healed from the elbow before she would even attempt to do the knees. So the deal that we made was 2 years. And then I went back for another consultation for the knees, and my elbows they healed pretty well, I would say. I mean, I had to do some lasers, and then I did camouflaging for the scar. But I'm fine. I'm happy with it.
Right.
It looks great.
Everything's a trade-off. So when we usually do thigh lifts, the incision is in the groin, or even going up like jeans in the inner stem of your pants. Now, a knee lift is a more visible scar than a usual thigh lift. The same way an elbow lift can be more visible than an arm lift. So the concept of a knee lift is similarly removing the wrinkles, skin above the knee. The same way skin sags down and gravity and loss elasticity, the skin above the knee tends to be wrinkly. So like the elbow lift, most patients, we could do it under local anesthesia where you numb the area and remove the extra skin. But you're going to have a scar. The scar may be the length of the wrinkles you have now, and it can be a little bit longer because we're taking out, a greater width of excess skin.
So for somebody like me, I have loose skin here and then would want to cut, you're saying above, like a little bit above.
Pinch the area of skin that bothers you.
Like right here.
Right. So that's kind of how I start with my marking.
Yeah, like right here.
I pinch out the excess skin. I don't make an incision directly above the knees like the orthopedic surgeons. When they want to make like a Hollywood incision, they make a transverse incision. And we know transverse scars for the knees just heal better because we want the incisions to go against movement. So this incision is factoring in, starting at the lowest part of the wrinkles, and you're removing the extra skin upward.
Vertical, right, so this way.
So when you're pinching the skin, yes, and then you see as you pinch it out where that excess ends, and the end ends wider than the kneecap. I mean, it's going across the
so
thigh.
I have the loose skin all the way across. So here.
Yeah, and the incision's going to go across the front of the thigh.
Which I'm fine with that. So this incision would actually go here.
Yeah.
Right. Which I'm fine
with. Look where the lowest wrinkle is. I see it on the other side.
Yeah, this one is more
right.
More
and then you see that lowest wrinkle.
So this one's actually, so my right knee is worse than my left knee. So it's actually here.
Right. And that would be the plan. I mean, the scars.
So the scar would be in this area.
Exactly.
Okay.
A little bit wider than you're doing with your finger, because the width of what we're removing, the length has to be about 3 to 4 times longer. So when you pinch out and you're like, okay, it's an inch of wrinkles, the incision has to be, significantly.
So we're talking about an incision for like 3 to 4 inches.
Yes, that's
so we're talking.
We know medicine we usually use centimeters, but it's easier, for viewers to understand inches. Yeah,
which I'm okay with that because for me, and my loose skin isn't as bad as it was. It was a lot worse before. I'm not sure why all of a sudden it's not as bad because I've done filler, I've done the threads, which Drs. Loeffler and I discussed not to do them anymore, so she would have pretty much a clean slate to work with. But I think I'm okay with the 4-inch scar as opposed to having loose skin.
Right, and most patients that have come for both elbow lifts and any knee lifts, which is not commonly done, I want to stress that. I do way more thigh lifts and arm lifts than I do elbows, and knees are the least frequent of anything. I want I don't want people to think, oh my God, this is what she does only. But people usually have tried filler, they've tried laser, they've tried threads, and nothing's worked to the desire of my patients. Patients feel that the treatments were temporary, or they didn't do much, or they had infections and problems and lumpiness. And at times it makes my job much harder to remove the extra tissue because there's scar tissue from these previously filled or injected products.
Yes, so it's better once somebody comes to you that they don't have, because I did the same thing with the elbow. Remember the first time we met, you wouldn't touch my elbows because I used threads and Sculptra, which was a disaster because it created the nodules. So we had to wait almost a year, I think, for those to go away. And with the knees, it was the filler and the threads, which I'm not doing anything now. Just
and it's a trade-off. The scars are a big trade-off. Some people would stick with fillers and threads and lasers and wait for better devices to come up because that's always an option. And some people like, what, when my knee's bent and I'm sitting down, I don't notice it. I only notice it when I'm standing and wearing a skirt, of a certain length. So these are, personal decisions, and I know you're motivated to have it improved.
Absolutely. And also Dr. Loeffler was an expert in my book, From Bullshit to Botox. So she's great. She's a great surgeon. She always has great information. And what would you say like an ideal candidate would be for these procedures? Somebody who just can't live with the sagging skin any longer? Or
somebody has to be, as all plastic surgery, in good underlying medical health. And you have to have realistic expectations that we're removing skin and you're trading off a scar. A scar could be, thin. A scar could be pink, a scar could be purple, it could be a keloid or raised scar, or the scar could be wide. You also have to be willing to limit your activity. because movement, flexing, walking, exercising, those things pull on the scar and can potentially open the incision or make a wider scar. We don't want that. Smokers are not good candidates. People have to stop smoking. And you just have to be compliant and willing to understand that there are risks and trade-offs. And it is a procedure that requires downtime, and it may take a year or even longer for scars to fade on the legs. The further you go from the face, the further down the body, the longer it takes for things to heal.
Oh, that's great information. So it does take longer for parts of the body as opposed to the face. I didn't realize that.
Yeah, the face has really good blood supply, and those incisions tend to fade by 6 months.
Yeah.
But as you get lower, even when I do like a breast lift and a tummy tuck at the same time for mommy makeover, the breast scars fade faster than the abdominal scars. Same surgeon, same date, same patient.
I've noticed that because I also did a breast procedure with Dr. Loeffler, and my breast scars are healed so well. Like they're completely have faded, but the elbow took almost 2 years. But I also worked on the elbow a lot with the CO2 and with V-beam and also the camouflaging. With
the scars are going to be red. They're going to be pinkish
red for a while.
And I encourage taping early on, and then silicone treatment and laser is an option. And when things are really healed, if the scar is still visible, if makeup's not doing enough, there are tattooing or blushing that could help more permanently with the discoloration. So you have to plan. It's not just one and done, but there is a lot of time for healing to see the final results. And sometimes it needs a revision or a little touch up.
I think it's great. I think the procedures are great, especially if somebody doesn't need the thigh lift, because almost every woman that I know my age or even younger complains about their knees. Almost everyone. Like, that's what happens over time. And I hear a lot of people complain about their elbows. So when I talked about it in the book of cutting the elbows, people were like, oh, I didn't know that you could do that, because they're just used to seeing the arm lifts. So I don't think there are very many surgeons that do what you do.
No, I mean, I was lucky because when I first started practice, they just popularized laparoscopic bariatric surgery. So I was seeing tons of arm lift patients and doing big incisions. I didn't even do some of these big incisions when I was like in residency. They weren't as common. And I just was at the time that just became so popular. And I had a patient who was a non-weight loss patient whose elbows really bothered her. And she kind of was like, no, we're going to do this. And this is how we're going to do it under local. And, she knew that it was the first time I was doing the procedure, and she understood all of that. And then we just kept going with it because people came in and that was a complaint. And then I did a video about it. And that's kind of how we ended up here and how I met Sandy.
That's how, because I kept Googling. I'm like, there's got to be somebody out there that will just do the elbows. Like, it can't be, if you can do a whole arm lift, why couldn't you do the elbows?
That was my thought process to begin
which is
with.
Great.
And that's how that started. Knees, I'm not pushing knees. But
I know. I pretty much had to do some begging here for the knees.
Yeah, as far as regular thigh lifts, thigh lifts take a lot to heal. When there's incisions for the thigh to lift the thigh up in the groin area, there's greater risk. There's infection risk that we have to worry about. There's even more movement. The knee itself, you just got to really avoid exercise. You don't want to walk around too much. I am not yet immobilizing or splinting anyone's knee. The elbow lifts, I usually do put people temporarily in a splint or at least a bulky ACE dressing to minimize movement over the area so we can get you the best scars possible.
But when you do the thigh lift, that doesn't really help with the knees, does it? Or does it?
No, the upper thigh lift doesn't get the knees addressed. Even when I'm doing a long thigh lift where the incision's going in the groin and inside the leg, the seam of the leg, it still doesn't address the knees. I mean, this is a direct excision of excess skin over the knee area.
And I know a lot of people believe in trying the lasers, and I've done that. I've done the filler and the threads, but for me, it just makes them look thicker. It fills in, but it fills in like where the lines are, but my knees overall look thicker.
Right, because you're filling, you're adding volume to the area. But people may have success with biostimulatories like
Right.
sculpture. Sculptures I don't find so predictable
Yeah,
everywhere.
exactly.
And this is an area of motion. Unlike putting sculpture in the face, even though
Right.
the face moves when we're animating, this is more, it's going to be more involved.
Yes. Well, thank you so much for taking the time today.
Thanks.
And how can
And-
our viewers find you?
I guess, I'm old, so I still have a phone number and a website. so 212-355-0500. But you can follow me as Dr. Michelle Loeffler on Instagram, or go onto my website as
Yes.
well.
And you're in New York City. So anybody that wants
Yes.
a knee lift or elbow lift, Dr. Loeffler is your doctor.
Thank you
Thank
so
you.
much for having me.
Thank you so much. This was great. Thank you.
Thanks, and wishing you a successful
Okay.
show.
Thank you. If you like what you're hearing, then click that subscribe button and share this episode with a friend to help us grow our community. We'll be back in a minute to talk about body dysmorphia. This is an important topic you won't want to miss. We've all been there, obsessed with little flaws that other people may not even notice. When that worry crosses into something more dangerous, it's called body dysmorphia. I've got licensed professional counselor Lane Happel on the line to tell us all about it. Hi, Lane. How are you today?
I'm good. Thanks for having me. I'm excited to be here.
Thank you for coming. We're going to talk about body dysmorphia today, which Rita and I both decided that we both have.
I am completely guilty of this. 1,000%. I have this. I ebb and I flow. I mean, it depends on the day, but yeah.
Yeah, we've been talking each other off the ledge. So why do you think so many people look in the mirror and they see flaws that nobody else notices?
Oh my gosh, this is a tough one off the bat. Well, our perception of ourselves is so different than what other people see because they see through a lens of themselves, which is their own personal lens. So they're going to everybody looks at us and sees something different based on, their own personal lens. So we have to look at ourselves. I don't even know what the statistics are of how many times in the mirror we look at ourselves over the course of our life, but I wouldn't even want to know. So our flaws are so much more obvious to us than they are to other people because of just the amount of time we have to look at ourselves.
That makes sense. Yeah, we've had some meltdowns, she and I, just from filming.
Literally, I think that being on this kind of goes into, Instagram and socials and stuff like that. I think being on camera lends itself to having a bit more of this dysmorphia. And in my opinion, and correct me if I'm wrong, I think it becomes a cycle. So then it's like you see all these people that are public figures and then all of a sudden they're like losing all this weight because they feel like they look a certain way on camera. And then the public sees them and then they're getting dysmorphia because they think that they have body issues because they're not meeting the standard that this person on TV. And it's like this vicious cycle of dysmorphia.
Yeah. And I can see how it happens because the camera's already adding weight, and then you add like a lighter color, like a white outfit, and then you're adding more weight, and it's enough to like drive you crazy.
Absolutely. And I think my favorite quote or something that was told to me was when we take a picture of the sunset, like what we see is so beautiful, right? That we're like, we have to take a picture of this. And then we look at our picture and we're like, well, this is shit. We don't say, oh, the sunset looks terrible. We say our picture looks bad. Our picture didn't capture the beauty of the moment, but we don't blame the sunset, but we do that to ourselves. We might leave the house and think like, oh my God, I love the way I look. I love my outfit. And then it's like, we see a picture of it and we go, ooh, that's not what I look like in my head. But we blame ourselves for that, or we think something's wrong with us, not necessarily the way the camera sees it.
Well, the camera's two-dimensional, so...
And it's not real life.
And it's not real life.
It's funny because my husband, he's not a big poster at all. Like, he's barely on socials. And he posted this really sweet picture of me and my daughter. And I got so mad at him. Like, it was really psychotic behavior on my behalf. Like, my husband, who never posts anything and is like trying to share this sweet moment of his wife and daughter, and his wife's like screaming at him, like, why would you post that of me? Look at my face. I look so tired.
Which now he probably will think twice the next time he posts.
And it's like, he did this nice thing. And it's like, why are we acting like this? What is the root of this? Is it vanity? Like, what's going on in our brains that are making us like this?
Well, listen, I think your husband probably thinks that picture was beautiful, right? Like,
yes, exactly. It's
It's like, no, you look beautiful in that picture. You just don't see it. I think, look, at the core, there's a lot, but throughout our evolvement as humans, the comparing is not good for our brains. It's just not what's going to happen. And the more that we compare to other people, the more our self-worth and our self-esteem is going to take a toll, because it's just not realistic, and it doesn't really represent like each unique individual and our unique, features and all of that. So we're comparing apples to oranges essentially, and we're just going to be disappointed if that's where our focus is. So I think the social media aspect definitely makes you compare a whole lot more than you ever would have.
Because so many people are using the filters, and it's just fueling our culture with all of these misconceptions.
So those of us out there that have young girls, what can we do so our girls don't fall into the trap that we're in right now?
Yeah, well, I would say delay social media as long as possible. I know that that's so hard. I have 2 boys myself. I have an 11 and a 7-year-old, and the 11-year-old is really kind of like pushing for the social media because it's such a big part of their social life. It's like, well, this one has that, and I can't contact, I don't know where everyone's going.
They like talk on Snapchat with each other and stuff. Yeah. Exactly.
So delaying that as long as possible, or at least monitoring like what accounts are being followed, what they're kind of ingesting through social media, and then also how you're talking to yourself is really going to be impactful on how your daughters talk to themselves. So it's more of like watching you be kind to yourself and be complimentary to yourself and not be hard on yourself. Even if you want to do it internally, just remember that they're watching, and they're essentially going to model what they see, not what you tell them.
Which is so hard. And I think that a lot of high achieving overachiever women, and you've overachieved your entire life, whether it was in your career or whether it was, at the gym. And then it's really hard when you're parenting not to be hard on yourself, right? And, keep it to yourself.
For years, I was living on the scale. And then I noticed my daughter doing it. And I was like, this is bad. So I stopped doing it, but she just started modeling what I was doing, and it was not healthy.
Oh, even me, like I now secretly get on the scale. Like, I'm not going to stop getting on the scale. I'm just not. I'm beyond being cured of that. However, I am really making a cognizant effort to not let my daughter see me get on it every morning, and have her.
Because they learn.
If she does get on it, like we get excited about gaining weight because she's so little, like, oh my goodness, look, you gained weight, you grew, this is awesome. You're fueling your body, and kind of switching the narrative where weight isn't necessarily a bad thing, because after all, it is such an arbitrary number, right?
Yeah, absolutely. I go off of like, okay, how do you feel? What do you internally feel? And again, switching the narrative from, all right, you're increasing in weight, but you're getting stronger. Your muscles are building. Your body is getting stronger and healthier, and you're nourished, and like all of that sort of language around like a healthy body instead of a healthy weight.
And what's one powerful mind shift shift in mindset would you say that can help listeners to start seeing themselves in like a more healthier, loving way?
Oof. Okay. So acceptance it sounds really simple. And it's like, of course, if you just accept yourself, like, sure, I wish I could do that. But truly, that is a journey of really just leaning into some of your flaws and accepting the parts of yourself that you dislike, because we all have those parts.
Yeah.
And it could have stemmed from childhood, from adolescence. Adolescence is usually where we kind of become really conscious of our body and our self and our appearance and start comparing outward to other people. So I think that having a narrative of self-acceptance where it's like, I don't love this part of myself, but it makes me who I am, and I'm going to work on accepting it. I'm going to make room for it. I'm going to make space for it. I'm going to make space for the fact that I don't love it.
You know,
Yeah, no, you're right.
Going with that, I think personally, I have stopped, and this is very hard for me because I'm very OCD. I'm a hyper perfectionist, but I have tried stopping, aiming for perfection with my body, because if you look, you don't want to look like a filter. You want to look human, right? Like, you don't want to have perfect teeth and a perfect nose and perfect everything. Like, normal people don't look like that, and it almost takes away from your prettiness. It's like when Jennifer Grey changed her nose.
Oh, yeah.
It's like she was so unique and beautiful, and then she took that away.
No, you're right.
So I almost feel like it's good to take a step back sometimes and say, hey, like, my imperfection is what makes me beautiful.
Yeah, 100%. That's
This
it.
was great. Again, we're so happy when you come on our show. This has been really great for our viewers.
And for us.
And for us. Because
we're going to take a breather.
Yes. I'm going to breathe now.
I'm going to stop sending her screenshots of myself.
So she had meltdowns last time we filmed. Today I was having meltdowns because lighting and outfits and the camera, because the camera adds weight depending on your outfit. So
we're cured.
Yeah, I'm well again.
We're well. We were unwell and now we're well.
If you really want to challenge yourself, the other piece is like exposure therapy. And if you really want to challenge yourself, leave the house in something that you don't think you look great in. Or
well, I mean, that's every morning at the carpool line.
I do that every day, When I go to the gym every day, I look like a homeless person.
I do that all the time.
Yeah, that I do.
That's not a big deal.
I won't do that.
See me at Whole Foods and you'll know.
You're nailing it.
Thank you so much, Blaine. This was great.
Thank you.
Awesome. Thank you, guys.
Now it's time to spill it, where my friend Vita and I, are you ready?
Oh, I can't wait.
Answer your questions and nothing's off limits. Vita, I think this is a good one.
Oh, I can't wait. Let's see.
Dear Sandra, I'm a successful executive and have been dating an artist for the last few months. He doesn't make as much money as I do, and I don't mind picking up the tab some of the time. But now he never even reaches for his wallet. Is he taking advantage of me?
Okay.
100%.
So call me old school, and I'm probably going to get a lot of haters from this one, but like, a guy should be a guy and reach for his wallet. I don't care about the discrepancy in income. At least offer, like, whatever happened to old-fashioned courting?
Well, chivalry.
Yeah, court the woman and offer to pay for her dinner.
When you're dating somebody in the beginning, especially, I feel like the man should be paying for the dates.
100%.
Like, that's the least they can do. Now, once you've been in the relationship for a long time,
like living together and splitting
then that's different.
expenses.
Then you're
and
buying
all
groceries,
that.
paying for the
That's
cleaning
different.
service, whatever.
No, that's different. But
you should never open your wallet for a
in
man.
the beginning, and it's like he has alligator arms. He's
Alligator
that's
arms.
what you call it.
Yes,
When they're like the
alligator,
Chuck
like the
Palms.
shirt.
Don't date anybody with alligator arms,
Never.
ladies. 'Cause it's gonna not end well.
Never ever allow it, or never date a man that's not going to pay for your
You know
dates.
what's going to happen? You're going to marry him, and then he's going to be sitting pretty all day on his laurels, and you're going to be working and raising.
You're going to be supporting the family.
Yeah.
Because if he can't pay for dates, how's he going to support a family? Like, this is ridiculous.
Yeah.
How's he going to be able to support or even pay half of the rent or mortgage or whatever when you get married?
Yeah.
He won't be able to.
No alligator arms.
Yes. If he can't afford dinner, he can't afford you.
I agree.
Thanks for sharing your questions and keep them coming. We love hearing from you. If you're enjoying our conversations on Party's Over, then like and subscribe. And for much more, pick up my book From Bullshit to Botox. Until next time, stay radiant, stay ruthless, And remember, your reflection should never be your enemy.